That's right, and the doctor is in, and today's topic is how to stay healthy during pregnancy. It's something that can be tricky for many women, especially because everyone loves to give pregnant women advice. So ultimately, staying healthy depends on you, and today we're going to have some simple tips to help set you straight. So joining us today once again is Dr. Ackerman, one of the First Coast's leading doctors. He is here with us every week to discuss a variety of health topics, and we also welcome Gisela Morgan, a fitness instructor who is just a few weeks away from giving birth, but you look phenomenal.
Thank you.
Thank you so much. Not that I'm saying that someone who is pregnant and is 2 weeks away doesn't look phenomenal if you're out there and you're pregnant, but you look great. So Dr. Ackerman, let's get right into this. When should women start thinking about their health during a pregnancy?
Well, first, thank you, Casey. First of all, there's about 12,000 children born in Duval County every year, which means 35 a day. So, Nick, you've seen a lot of women who are pregnant. That's because 33 are going to be born every day.
Wow.
So that's a lot. And women should start thinking about their health during pregnancy before they're even pregnant. If you are of pregnancy age, if you're thinking about getting pregnant, or if you're trying to get pregnant, you should start thinking about your health then, before you're pregnant.
Oh, that's a good advice. A lot of people think once I get pregnant, then I'll start planning things out, but it's better to be doing so beforehand.
Right, because the first few weeks of pregnancy are the most vital weeks for child development.
Oh, wow. So now when you get pregnant, a lot of women will say, okay, now I can eat whatever I want. I'm eating for two. It's just I can pile up the food on the buffet line, but you're saying that's not such a good idea.
Right. You shouldn't really be eating for two. We don't want to see women gain weight during pregnancy. When you gain too much weight, you want to gain the appropriate amount of weight, which is about 25 to 35 pounds. But if a woman gains too much weight, they get what's called gestational diabetes. That's diabetes, and if you have gestational diabetes, high sugar levels, your baby will as well. So we try to tell women to eat healthy for two. Eat healthy while you're pregnant, but remember, be double healthy, because you're trying to be healthy not just for yourself, but also for the child that's inside you.
Which is so true. So are there foods that we should be eating, foods that we should be avoiding? What are some guidelines?
Well, we want to eat healthy and have a well-balanced meal like we spoke about last week, but it's very important to have all the vitamins and nutrients that a baby needs for development. So you want to make sure you have your vitamin A and your vitamin D and your for bone development, and calcium for bone development. You want to make sure the B vitamins are in your diet so that you have good neurological development for the child. Vitamin C for immunological development. So all those vitamins. Now we do have prenatal vitamins. You can go to the health store and get prenatal vitamins. Gisela's taking prenatal vitamins that her doctor recommended for her. And those prenatal vitamins don't replace the nutrients that you should have in a well-balanced diet, but help ensure that you are getting all those nutrients for proper development for the child.
Okay, so let's bring Gisela into this, because let's talk about exercise.
Yes.
Is it a good idea, Dr. Ackerman, to be exercising?
Yes, it is. And Gisela is a certified fitness instructor. She specializes in prenatal exercise as well, and she's going to demonstrate some moves today, some things about yoga and Pilates that one could do, and we're going to talk also about the proper exercises that one should do during pregnancy and what women shouldn't do during pregnancy.
Right. I remember you guys just a second ago when we were running through this, you're talking about the hunched over shoulders. I'm like, I do that every day, but you're saying that gets accentuated, right,
Yes.
when you're pregnant?
Yes. Yeah, it's a lot of problems happen. You know, a lot of the moms ask questions like, is it safe to exercise? And you know, that's a very common question. And you want to first check with your doctor to make sure that with your specific pregnancy that is healthy for you. And if you do feel healthy, that is the most important time to exercise. To continue exercise, if you haven't done it yet, you want to slowly start exercising. You're aiming to just be fit and flexible. You know, you don't want to push yourself, you don't want to be lifting more weight, but you do want to work on your cardiovascular aspect by walking 30 minutes a day, or swimming. You know, it's great to take the pressure off the body. Also biking, but I would recommend a stationary bike because it's safer. And then yoga and Pilates are great, though you do want to make sure that your teacher is certified through pregnancy. If it's not a prenatal class, you may want to tell your instructor that you are pregnant. So they modify the poses and the exercises for you.
Sure. So
there's certain challenges that women have with their body, and Giselle's going to demonstrate for us some exercises to overcome those challenges. So when the woman's pregnant, her head goes forward, her back becomes kyphotic, where the spine bends, the shoulders roll forward, the abdominals stretch and the abdominal muscles get weak, the pelvic tilts funny, and the knees kind of get locked up. And so Giselle is going to show us some exercises that one could do to avoid that and to combat that.
Yes, very true. And yoga and Pilates really does help to compensate, or at least to release the pressure that the body is changing through the pregnancy. And often in my classes, we do use a chair just for stability. And I'm going to do the cat exercise. It can be done on the mat, or it can also be done on the chair. The cat exercise, you're thinking of scooping the spine, drawing the head in, and really pulling the belly button into the spine. So I'm rocking my baby, and then we open the chest. Quite a great stretch on the chest for the shoulders to release that pressure off. So we do a few of those. Also it's to release the neck pressure. So we often do neck exercises, neck stretches to really feel the release. Also a very good one is the downward dog, but we do it modified with a chair. So, and the reason why is because we don't want to bring the head below the heart rate and the blood supply that the pregnant goes through. It's demanding, so you don't want to bring your head too low for too long.
Yeah, you don't want to pass out or get dizzy or anything.
Exactly,
being pregnant.
exactly.
Okay, sure.
So the downward dog, we do it with hands on the chair, thinking of really pushing the hips back, really feeling the back nice and long. That's a great stretch for it. Also, we have the triangle, which you can do it with a chair or without it, which you use to support. You open, you're feeling a good side stretch. Not only here I'm stretching my lateral obliques, but I also feel a good stretch on the hips, on my hamstring as well. We have other things like the pigeon. You can do it on the floor, but do it towards the last trimester. Definitely we do it on the chair because we don't want to go down to the floor too much. So the pigeon is just opening the knee to the side, leaning slightly forward with the chest nice and open. So that's a great hip stretch.
It seems like they're very low intensity kind of things.
Yes.
More stretching. I think one of the worst things you guys were talking about earlier, Dr. Ackerman especially, is you don't want to do anything that's going to harm the baby. Low intensity.
Right, you want to be sure that the exercises you do, like yoga or Pilates, are ones that are low impact. Swimming, walking, that sort of thing. You want to avoid high impact things that jostle things around too much jumping.
Okay, yeah, because after all, you've got a little one, so you got to take care of the little one.
You got to breathe different. You want to make sure the breathing is calming and you're drinking plenty of water.
And Dr. Ackerman, how important is drinking water?
We talk about that all the time. Water is great. It keeps you healthy and nutritious.
All right. Well, thank you so much. We appreciate, Giselle, you being here. And Dr. Ackerman, as always, our resident Dr. Oz, being here and giving us all of this great information. Thank you so much. And, of course, the doctor is always in. If you ever have any questions for him, you can go to our Facebook page. There's all kind of information there. We also want to thank First Coast Oncology for being here and sponsoring this segment. Dr. Ackerman is with us every Friday. And next week, we're going to be talking about that flesh-eating bacteria, that's been in the news a lot lately, so be sure to watch that. And if you have a question for Dr. Ackerman and you'd like him to answer it on the show, again, you can post them. Actually, go to First Coast Oncology Facebook page. Visit them at facebook.com/First Coast Oncology.